professionals of New Haven, Connecticut are here today to stand together on behalf of the healthcare workers of the world and of the Gaza Strip. Woo! The both of us standing here before you today speak in solidarity with those martyred, as we too are first-generation descendants of genocide survivors. Our histories and resulting present lives intertwine. When one nation falls into the unrelenting cycle of violence, we all fall. Palestinian healthcare workers have taken on the unimaginable work of caring for a community that has been devastated by daily military strikes and the scarcity of food, water, electricity, and fuel. Under the Geneva Conventions, hospitals must be protected and may not be attacked under any circumstances. We unequivocally condemn the absolute betrayal of medical ethics that we have seen in Gaza. Since October 7th, 14 out of 35 hospitals with inpatient capacities have stopped functioning. 71% of all primary care facilities across Gaza have shut down due to damage or lack of fuel. Israel has issued evacuation orders to at least 23 hospitals in Gaza, which the World Health Organization calls a death sentence for the sick and injured.
As healthcare workers, we are bound to respect and protect human life. We are horrified to witness the atrocities of the past month. We denounce the targeting and killing of all innocent civilians, and we grieve for all those whose lives have been lost.
As of Tuesday, November 14th, there are a reported total of 11,320 fatalities, including 4,650 children.
As of November 15th, a total of 223 healthcare workers have been killed. 72 nurses, 37 physicians, 26 pharmacists, 21 medical and dental students, 21 paramedics, 20 dentists, 14 lab technicians, 7 occupational and physiotherapists, 4 medical scientists, and 1 optometrist.
We are calling for an immediate ceasefire, the provision of humanitarian aid, and a demand to stop targeting healthcare facilities to an already devastated healthcare infrastructure. This is a historical moment where we have a moral obligation to say something and to do something. Right. We are calling on the global medical community to stand with us for our demands. Now is the time for an immediate ceasefire and an end to the occupation. Woo!
Hi, my name's Frida. I'm an APRN student at Yale. I am going to be reading a statement on behalf of one of our organizers today. This person did not feel comfortable reading this statement themselves because of the hostile environment that Yale and YNHH has created for its students and its employees. Salam. I am a Palestinian American working at the School of Medicine, and I wish I could share my whole story with everyone in person. Unfortunately, the space and culture that is tolerated here continues a pattern of censorship and suppression of speech. However, I feel that it is important to have at least parts of my story shared. I grew up in the West Bank and have traveled around different cities in Palestine. I remember having to cross several checkpoints when having to visit my aunt and cousins, and I remember seeing military personnel out of my bedroom window raiding residential buildings in my neighborhood to arrest and kidnap people in the middle of the night. But this part of my story is actually not about me. This is about the experience of healthcare workers in Palestine, to be shared to all of you, the healthcare workers for Palestine. I have witnessed firsthand what healthcare workers have to endure in order to fulfill their duty. My parents were clinicians, and my dad would go do surgeries in different cities. A large reason for his travel was to reduce the travel burden on the sick patients and their families, despite risking his own life in the process of getting there. You see, one of the things about having an apartheid system is that there are different roads built within the West Bank for use by Palestinians versus roads that are used for settlers only. It's very well known that if you do not know your way and take a wrong turn where you end up in a settlement road, you can get physically attacked or killed. Even once he's made it to the hospital in Ramallah, Nablus, Bethlehem, or elsewhere, there would often be times where his patients from smaller towns and villages would not be able to make it. Villages and rural communities in the West Bank often experience the most frequent violence and terrorization from the settlers. Settlers that are often accompanied and protected by the military. A military that has continuously testified that their orders are to protect the settlers and nothing else. Even when a patient makes it to the hospital, there is no guarantee that the hospital won't get raided and attacked. Just last night, the Israeli army had raided Ibn Sina Hospital in Jenin, enforcing a siege and asking all medical staff to exit the hospital. 2 medics refused, and they were subsequently arrested. There is absolutely no dignity or respect provided to anyone there. If a patient makes it and receives care but needs a more complex surgery, they need to travel to get a special permit from Israel to travel to either Israel, Egypt, or Jordan to get treatment. And often they have severe limitations on having accompanying family members, with many patients being denied travel altogether. The reason patients often need treatment elsewhere is because all medical tools and equipment are imported via Israel, and thus they control how much help the medical field can provide. For instance, there is no PET-CT services available in any Palestinian hospital in Gaza or the West Bank. We are also seeing this control in Gaza simply by deciding what aid comes in and out on the trucks, deciding when to shut the necessities of life on or off. The added burden of communications blackout has rendered ambulances ineffective since they can't get communication on where the injured citizens are. I know we are gathered here today to call for a ceasefire and an end to the massacre and humanitarian crisis happening in Gaza. The atrocities and massacres in Gaza are absolutely horrific, vile, and nothing short of inhumane. And I hope that people can keep seeing what's happening there and understanding it in the greater context of the apartheid and the occupation that has become all too commonplace for Palestinians living there. All of the issues I have brought up had existed long before October 7th. While Zionists make it sound like the whole world has stopped since October 7th and nothing else matters, it has certainly gotten much, much worse for Palestinians everywhere. We already see the footage of mass graves being dug in the Shifya Hospital yard, while hundreds of thousands that have been displaced are on the brink of famine and public health crises. Surgeons and doctors have triaged everyone into a life or death category, where only those that would die without surgery would get it, effectively rendering many with serious injuries to the heads and internal bleedings without any treatment. In the West Bank, doctors can no longer travel and see their patients or follow up on them. Roads are completely closed and most people are having to delay treatment. Many doctors have to now travel via an ambulance for their safety, a luxury that is not always guaranteed or can be afforded. Even when passing through roads with the ambulance, many of the roads are physically blocked with cement blocks or destroyed to prevent cars from going on. This has effectively rendered any businesses and livelihood on those roads obsolete, while also denying the time it takes for proper medical care to arrive when needed. I appreciate every single one of you for speaking out on behalf of those of us who have felt ignored, deserted, and dismissed by the utter silence and lack of support from those in positions of power. How can expressing support for medical staff everywhere around the world become such a divisive ask? Institutions like Yale and beyond always brag about being global leaders, yet there is nothing global about ignoring half of the world. These barbaric acts against medical staff and patients, including babies in incubators, deserve more than silence. As healthcare workers and as people who have devoted their lives to helping others, we must speak up. Is it too much to ask for equal treatment and support to the Palestinian people so that we may live in safety and with dignity? Staying silent is staying complicit, and it's shameful that we have to speak this loud so you can hear us when we say, "Free! Free Palestine!
Free! Free Palestine!" Ceasefire now! Ceasefire now! Ceasefire now! Ceasefire now! Ceasefire now! Ceasefire now!
training as an Afghan-American nurse and soon-to-be midwife. I have been there to ensure your safe deliveries and advocate for your sisters, mothers, daughters, or friends in their births. I have cried with you through your losses and pains of pregnancy and in the difficulty of your postpartum periods. I am here as one of many healthcare workers to speak on the injustice that weighs heavy on our hearts as we care for you. At this moment in time, 50,000 women are pregnant in Gaza. 5,500 have due dates this month, meaning every day 180 women are going into labor with no options of hospitals to deliver at safely. Where are they to go when there is no anesthesia for their required and emergency C-sections? Where are they to go when they know their premature babies relying on neonatal care will die because hospitals do not have the resources to sustain them? Where are they to go when they have contractions but Israeli air missiles strike around them and they have to choose between leaving their families or risk never seeing them again? I cry in between patients when I see mothers have safe skin-to-skin with their newborns because I think of the babies whose cheeks will never rest on their mother's warm chest. I cry when I hold my patients' hands through C-sections, thinking of the indescribable pain and suffering that Palestinian mothers are enduring in Gaza without numbing medication for their surgeries. I cry when I see mothers in NICU hold their small premature babies through the incubators because I think of the 39 babies at Al-Shifa Hospital who are at risk of dying at any moment. Palestinian mothers have unconditional love for their newborns just like you. A mother in Gaza named Awad said, "The doctor told me that there was water in her lungs and that she needed to be monitored. So I've been sleeping with her in the nursery." Amidst her people's genocide and ethnic cleansing, Awad still remains by her baby in NICU, just like you. Just like you, Palestinian mothers are lingering and waiting expectantly for their newborns in NICU. Just like you, mothers in Gaza have dreams and aspirations for their children they so lovingly held in their bellies for 9 months. Reham Ahmad al-Sadi had always dreamed of having a baby girl. And now, at 9 months pregnant, she is dealing with reality of giving birth in a war zone. She says, "The war destroyed my joy about pregnancy." You do not need to be Palestinian to understand the universal affection a mother has for her unborn baby and newborn. Everyone deserves the right to a safe birth, and borders or governments will never change this fact. I will finish with a poem by M. Barry. This morning I learned the English word Gaz comes from the Arabic word Gaza, because Gazans have been skilled weavers for centuries. I wondered then how many of our wounds have been just because of them, and how many of theirs have been left open because of us.
Every morning I force myself to start my workday with a smile on my face and be the best healthcare provider that I can be, even as my heart breaks over and over again for the people of Gaza. Every evening I come home and, already exhausted by the day's efforts, read of some new horrific story to befall innocent civilians. As of Wednesday, November 15th, the WHO reported nearly 50,000 cases of diarrhea since mid-October, a presumed underreported number due to the current conditions of hospitals. Over half of those cases were documented in children under the age of 5. That is over 2.5% of the entire population of Gaza. Here we recognize that the most common cause of dehydration in young children is in fact diarrhea, and in a city where water is already irrefutably scarce, Gazans are struck in an endless cycle of drinking tainted, unpurified water to survive, and subsequently dying from the microbes that same water harbors. I think of my chronically ill, immunocompromised patients who face setbacks for weeks as a result of gastrointestinal infections, Weeks with a world of healthcare at their fingertips, and recognize that for Gaza, we have only reached the beginning of what is presumed to be the most catastrophic public health crisis of our generation. I remember that every day this country fails to call for an immediate ceasefire is another day that it has failed us, its healthcare body, by forcing us to witness the same transgressions we swore to protect our patients and communities against. On behalf of your healthcare providers here, and on behalf of all healthcare providers in Gaza, I urge you to call your representatives today and demand a ceasefire. The population of Gaza depends on it.
We are all born with compassion, generosity, and love for others inside of us. We are all moved by injustice and discrimination. We are all, inside, concerned human beings, says political activist and philosopher Noam Chomsky. How lucky are we to allow our compassion to flourish in guaranteed full safety for our oncology patients here. Meanwhile, with no proper treatment, the 2,000 cancer patients in the Gaza Strip live in catastrophic health conditions. Reem Ashraf, a female patient with thyroid cancer, has had no access to medications since the siege on Gaza. Essential medications and basic equipment are exceedingly scarce, with minimal humanitarian aid permitted to enter. Ashraf was supposed to get treated at Al-Muqassid Hospital in East Jerusalem, but the main crossing with Gaza in the north has not been in function since October 7th. Ashraf underwent 2 surgeries, including one to remove the tumor from her neck, but needs further treatment and checkups. I cannot move or even stand due to the deterioration of my health and the lack of painkillers necessary for my condition, she says, after she was displaced from her home in Gaza City. Ravaged by war, even the simplest analgesics are inaccessible, and thus pain in hospitals have been primarily managed with screams of agony and prayers.
As a member of the Palestinian diaspora, I grew up witnessing Palestinians on the news enduring inhumane oppression and ethnic cleansing. Whenever I had the chance to visit Palestine myself, I would experience firsthand how is it like to live under an apartheid state that does not value the lives of Palestinians. I saw with my own eyes and I heard stories of extended family members and friends suffering from serious illnesses, sometimes due to injuries inflicted by occupation forces, yet they would be unable to receive necessary health care while living in the occupied territories. Often, the appropriate medical care was only available at Israeli hospitals, which Palestinians could not access themselves without a special and rarely given permit from the Israeli apartheid government. Today, having become a doctor, I've learned that all doctors under the Hippocratic Oath are obligated to provide medical care to patients in need, regardless of race, ethnicity, nationality, or origin. However, I am witnessing even worse crimes, Israeli forces besieging, invading, and terrorizing entire hospitals, preventing patients from receiving medical care and access to clean water, subjecting them to a slow and painful death, alongside the medical staff that vowed to care for them under any circumstances. Witnessing these crimes, which go against everything I was taught in medical school, I see them being committed with support from the US, a country that has enacted laws meant to protect patients and healthcare workers, yet it supports the violation of these very laws. Yet it supports the commitment of war crimes. I witnessed these crimes without any condemnation or expression of concern from the Yale School of Medicine, or even an attempt to offer support to its minority Palestinian members. This must end. The world cannot continue to watch and be okay while genocide occurs, while preterm infants are left to die in their incubators. Wounded children are left to die suffering from injuries by the Israeli bombs, and men and women die from infections caused by the lack of clean water, while the elderly and chronically ill perish because they are denied necessary medicines for survival. This must stop. Ceasefire must happen now.
Ceasefire now! Ceasefire now!